Hello everyone! Next, we will learn about caring for patients with chronic bronchitis. Chronic bronchitis, abbreviated as chronic bronchitis in Chinese, is a common respiratory disease among the elderly. The occurrence of this disease is related to multiple factors. Infections such as viruses, mycoplasma, and bacteria are significant causes for the onset and progression of chronic bronchitis. Inhalation of harmful gases and particles, such as cigarette smoke, dust, etc., is also an important factor in the development of this disease. Additionally, aging, declining immune function, and stimulation from cold air, among other factors, also easily lead to repeated respiratory infections in the elderly. The main symptoms of this disease include cough, sputum production, wheezing, or shortness of breath. Coughing is usually most prominent in the morning. There may be paroxysmal coughing or sputum production during sleep. Sputum is often expelled after getting up in the early morning. The sputum is mostly white and mucoid. If the patient also has emphysema, they may experience shortness of breath after exertion or activity. In patients' daily lives, if respiratory infections caused by viruses, bacteria, mycoplasma, etc., occur, it can lead to a sudden worsening of symptoms such as cough, sputum production, and wheezing. We refer to this as an acute exacerbation. Medical treatment should be sought promptly at this time. Next, let's look at the daily care for patients with chronic bronchitis. Care for patients with chronic bronchitis primarily focuses on enhancing physical fitness, preventing colds, and quitting smoking to reduce acute exacerbations. Enhancing physical fitness, preventing colds, and quitting smoking are also key measures in the prevention and management of chronic bronchitis. Enhancing physical fitness is the foundation for preventing and managing all diseases. To enhance patients' physical fitness, care regarding diet, rest, and exercise needs to be strengthened. Regarding diet, patients should be encouraged to eat nutritious, easily digestible foods. Foods high in protein, high in calories, high in vitamins, and low in fat are advisable. Drink plenty of water, no less than 1,500 milliliters per day. Adequate fluid intake helps dilute sputum, facilitating its expulsion. Attention should also be paid to rest in daily life. Among these, sleep is the most important form of rest. Ensure patients have sufficient sleep and maintain a balance between work and rest. At the same time, based on the patient's individual condition, select appropriate aerobic exercises to enhance their physical fitness. As mentioned earlier, infection is a significant cause for both the development and acute exacerbation of chronic bronchitis. In daily life, we should focus on preventing respiratory infections. Ventilate rooms frequently, keeping indoor air fresh, pay attention to weather changes, add clothing promptly, and prevent chilling, especially during cold seasons. Get vaccinated against influenza, pneumonia, etc., in a timely manner to improve the body's immune function. During flu season, avoid crowded public places. Avoid contact with individuals with respiratory infections to prevent cross-infection. For patients with obstructive emphysema and significant dyspnea, long-term home oxygen therapy may be implemented. Next, I will introduce two methods for respiratory function training: pursed lip breathing and diaphragmatic, abdominal, breathing. Pursed lip breathing involves closing the mouth, inhaling through the nose, then exhaling slowly through pursed lip. Contract the abdomen during exhalation. The inhalation to exhalation time ratio should be about 1:2 or 1:3. Let me describe the specific steps. First, the patient relaxes the neck muscles, closes the mouth, and inhales slowly through the nose. While inhaling, silently count 1, 2. Then, bring the lips together, leaving only a small gap. It's similar to whistling. Exhale slowly through the pursed lips. While exhaling, silently count 1, 2, 3, 4. Next, I will demonstrate. You can place your hand on your abdomen. Close your mouth, inhale through your nose. Then, when exhaling, purse your lips as if whistling, leaving a small gap. Exhale slowly. And you can silently count 1, 2, 3, 4. Now, demonstrating the exhalation. Next, let's introduce diaphragmatic breathing. For diaphragmatic breathing, The patient can assume a standing position, supine position, or semi-recumbent position. Place both hands on the chest and upper abdomen, respectively. Inhale slowly through the nose. At this time, the diaphragm descends to its maximum extent, and the abdomen relaxes. During inhalation, the abdomen rises, and you will feel the abdomen lift under your hand. When exhaling, exhale through the mouth. The abdominal muscles contract, the diaphragm relaxes, and you will feel the abdomen fall under your hand. Diaphragmatic breathing training is typically performed 3 to 4 times daily, for 8 to 10 minutes each session. Because diaphragmatic breathing increases energy consumption, it is generally not suitable for patients during acute exacerbations. It is usually practiced during the recovery phase. Patients often have excessive sputum. In daily care, we should also guide patients to adopt effective coughing techniques to promote sputum expulsion and keep the airways clear. Specific method: the patient sits upright. First performs 5 to 6 cycles of deep, slow diaphragmatic breathing. Then, take a deep breath in and hold the breath for 3 to 5 seconds. Subsequently, purse the lips and exhale slowly to expel the air from the lungs. Take another deep breath in, hold it for 3 to 5 seconds. Lean the body forward and perform 2 to 3 strong coughs using the chest muscles. While coughing, you can contract the abdominal muscles or press on the upper abdomen with your hands to assist in expelling the sputum. Alright, that concludes this section. Thank you everyone.